Welcome back to part 2 of this 3-part series titled, The Profound Cancer Cure Breakthrough Cover-Up. The following content focuses on a controversial cancer cure introduced to the medical industry by Dr. Stanislaw R. Burzynski, and the various obstacles he faced to prove the validity of his medical practice and findings. This is an ebook playback publication. The sectioned areas within this presentation will be the focus of the topic matters shown in the table list. You can pause the video to overlook them if you like. And now on to the main content. Chapter 2. The doctor is getting hot under the collar. Oh yeah, there's not a shred of doubt Dr. Burzynski was getting quite heated in the collar region. Although, more important matters needed attending to, so there wasn't any time to start chafing at the collar. Even so, that would suggest more problems were about to come his way, whether he expected them to or not. Now, there was a popular talk show back in the 80s the good doctor made a guest appearance on. The name of the show was the Dr. R. Friedman Show, and it's here where a doctor was asked about Dr. Burzynski's medical cancer killing method. A medical expert named Dr. Harold Gardner was picked out of the crowd, gave a key statement that will serve as the focal point of this publication. Gardner gave a plausible answer, as he stated that Dr. Burzynski's credentials of scientific investigation is that of a medical professional. However, Gardner went on to say that the medical methods Dr. Burzynski has chosen to take an unfavored approach toward the traditional cancer management methods. What really hammered a nail in the coffin was Dr. Gardner's statement about aligning with the favorable approach toward cancer study and the proper traditional treatment practices. So, in other words, Dr. Burzynski's method approach was seen as an eyesore to many cancer healthcare practitioners. The Texas Medical Board goes after Burzynski. Dr. Burzynski went on with his medical practice as scores of visitors continually poured in from various states, even countries, to receive cancer treatment. Now, it was at this point where more and more attention started ramping up about Burzynski's miracle cancer cure. In fact, the span of attention was so great to the point where his patients were getting unexpected approaches by agents from the Texas Medical Board. And as many people know, getting agents of any kind on your tail is never a good thing. So were the medical board agents tracking down the doctor's patients? Well, according to Burzynski, his patients had contacted him to let him know about the encounters. After doing his own due diligence, Burzynski eventually learned that his patients were being told by the medical agents to file complaints against him. The good doctor was in utter disbelief after discovering such unpleasant news. Burzynski's luck would take an even worse downward turn after he had met and spoken with Dr. Robert Hickey. Hickey at one time was vice president of the MD Anderson Cancer Center. Hickey informed Dr. Burzynski about the questionable tactics relating to his cancer treatment methods. Things ran deep for Burzynski rather quickly after he was subjected to an investigation by the Texas Medical Board of Examiners. A parent's feedback, a daughter's fight. This is where things really get interesting, because despite the fact Dr. Burzynski was now being put Johnny on the spot, and it's not regarded in terms of him remaining readily available to attend to his patients. This is him being ready to face what else will be coming at him next. Now, there were patients who did speak out about undergoing Dr. Burzynski's alternative cancer treatment method. One particular case was publicized at a congressional subcommittee hearing, where a father lent comments about the effectiveness of Burzynski's treatment sessions. It was during a 1997 hearing, where Sergeant Rick Schiff stated how the doctor's cancer treatment eradicated his daughter's cancer. The hearing can be seen in a YouTube video titled Drive Burzynski's Cancer Cure. Schiff's story revolves around his daughter Kristen Schiff, who was suffering from a growing tumor located within the right ventricle of her brain. Mr. Schiff and his wife Paula set up chemotherapy treatments for Kristen, which later affected her health negatively over time. Kristen's parents didn't give up, for they weren't willing to settle for the worse as time was running out for their daughter. They thought long and hard, and seeing that further chemo treatments could prove fatal for Kristen, they decided to search for an alternative option. The Schiffs chose Burzynski's alternative treatment. The Schiff family decision was set, and Kristen eventually underwent Burzynski's alternative cancer treatment. Although, the decision wasn't an easy one for the girl's parents. They were terrified, and unsure whether or not Dr. Burzynski's cancer treatment would be able to reverse the disease's progression. In fact, Rick Schiff believed the cancer procedure was a complete farce. That was until Kristen's tumor started to recede in size, and her condition went from dire to stable. The Schiffs were very grateful to have what would seem like a permanent victory for their daughter's second chance at life. Unfortunately, that failed to be the case for Kristen, for she had succumbed to the disease she was battling against. Afterwards came more critical accusations thrown at Dr. Burzynski's cancer treatment method. Although, it was Kristen's father who announced his statement pointing out the damage already done to his daughter's brain. And if that's the case, then could Dr. Burzynski's treatment have saved the girl before she had undergone the chemotherapy treatments? Chapter 3. Burzynski's situation gets more complex. A series of events were now set in motion, and for Dr. Burzynski, time wasn't on his side, and a lot of it has quite a bit to do with the mounting controversy about his cancer therapy treatments. It was coming to a point where he had to ensure the validity of his cancer cure as soon as possible. The legal issues pitted against him, if true, could land him in prison for decades. Basically, Dr. Burzynski was being forced to confirm on additional accounts of the patients that were cured from his procedures. The most noted was Kristen Schiff's results after undergoing the doctor's cancer remedy. The best way to build validity behind this supposed cancer cure would be to check the stories of other patients. That's also not to mention searching for any conducted clinical tests surrounding Burzynski's medical remedy. The basic methods towards ridding the body of cancer. What has been proven? Most people know there are various treatments that can be used to either neutralize or to kill cancer. Provided below are a selection of the basic common treatments encompass the following. Surgery. This procedure entails removing the cancerous tumor and adjacent tissue, typically applied for localized tumors that haven't spread to other body parts. Chemotherapy. Using drugs to eliminate cancer cells, often combined with surgery or radiation therapy. Radiation therapy. Employing high-energy radiation to eradicate cancer cells, either independently or in conjunction with other treatments. Hormone therapy. Used for hormone-sensitive cancers like breast and prostate cancer, functioning by obstructing hormones that drive cancer cell growth. Targeted drug therapy. Directing specific proteins or genes involved in cancer cell growth and spread, either as a standalone treatment, or in combination with others. Now, one thing to bear in mind, is the particular method Dr. Burzynski used to initiate the effects of his eradication cancer treatment. In this case, the peptides, as mentioned before, are inhibitors that have the ability to disrupt the functionality of cancer cells. Peptides, and the various diseases they can kill off. Cells within the body function through a process known as signal peptide. It's crucial to recognize that there isn't a universal solution for treating cancer. The most suitable approach depends on cancer type, stage, overall health, and other factors. Consult your doctor to discuss treatment options tailored to your circumstances. Peptides are smaller versions of proteins, typically comprising 2 to 50 amino acids. They may provide pro-aging support, anti-inflammatory, or muscle-building properties. Recent research indicates that some types of peptides could have a beneficial role in slowing down the aging process, reducing inflammation. They are also known for destroying microbes. Vasopressin, also known as antidiuretic hormone, is a peptide hormone that originates in the hypothalamus. It regulates extracellular fluid by prompting the kidneys to absorb water. In higher quantities, it acts as a vasoconstrictor, narrowing blood vessels and increasing blood pressure. Alcohol consumption inhibits vasopressin, leading to increased urination. Oxytocin, a 9-amino acid peptide produced by the pituitary gland, plays a role in uterine contractions during childbirth and the letdown reflex during breastfeeding. Known as the cuddle hormone or love hormone, oxytocin is released during social bonding. Defensins, active in the immune system, are believed to have antimicrobial properties, aiding in wound healing. Angiotensins, part of the renin-angiotensin system, regulate blood pressure and stimulate aldosterone release to promote sodium retention by the kidneys. Peptides possess antioxidant, antimicrobial, and antithrombotic effects. Over 60 peptide drugs were approved globally by 2017. Examples include using vasopressin for diabetes insipidus and carnosine as a potential treatment for various conditions. Defensins, with broad-spectrum antimicrobial effects, are being studied for HIV-1 therapy. Hepcidin helps diagnose anemia by controlling iron absorption. Chromofungin, a peptide, is explored for treating inflammatory bowel disease. Antimicrobial peptides are used to treat conditions such as hepatitis C, pneumonia, HIV, and bacterial infections through various administration methods. Numerous peptides are under investigation for treating cancers. Atrial natriuretic peptide, ANP, shows potential for colorectal cancer treatment. Peptide-based cancer treatments, like luteinizing hormone-releasing hormone, LHRH, agonist drugs, are used to treat prostate cancer. Dr. Burzynski's keen understanding how peptides work is risky business. Remember what Dr. Harold Gardner told the talk show hostess while they were in Dr. Burzynski's presence. He mentioned how the medical industry is a very close-knit community that doesn't favor innovative ideas. So basically, he was saying indirectly that Burzynski's supposed cancer cure would not be well received. Well, hot damn. That sounds a lot like politics, where you have a long-time politician who knows politics like the back of their hand. Yet, here comes some business guy or gal, with not an ounce of political know-how, who steps onto the world stage strutting their stuff ready to debate. and as it has been shown, that person will get throttled and attacked viciously by the entire panel of congressional candidates. They will continually attack that individual left and right to the point where that contender just runs for cover. That's unless they truly know what they have to offer can benefit all of society. And if that's the case, then they will have to be obligated to fight for their cause. That's basically what it came down to for Dr. Burzynski. He quickly realized how difficult it was going to be. That especially went for anyone who thinks they can just waltz into the medical industry trying to promote a controversial cure of any type. This heavily applied to the peptide anti-cancer remedy he dared to acknowledge. And the medical industry wasn't finished with Burzynski, because they were bringing more hardship his way. We're at the end of part 2. Please make sure to like, share, and subscribe to the channel and click the notification bell. Part 3 of the Profound Cancer Cure Breakthrough Cover-Up will be airing very soon. Thank you for your viewership.